Hello, my name is Dr. Ayo Oladele and I'm a general practitioner at Hurley Group of Practices. Jess's Rule is a primary care initiative designed to reduce delayed and missed diagnoses in our patients. Jess's Rule is a legacy named after Jessica Brady. Jessica Brady was a 27-year-old lady who presented with symptoms of abdominal pain, nausea, cough, vomiting. It was reported that Jess presented to her local GP close to 20 times over a 6-month period, and there was no clear diagnosis. Sadly, Jess passed away weeks after her family decided to seek private consult and a diagnosis of cancer was made. Her family campaigned to implement Jess's Rule. They didn't seek out to blame, but it was done so that we could learn from what happens to Jess to prevent it from happening again. There are 3 key words in Jess's Rule. They are reflect, review, rethink. So in summary, if a patient is presented to a primary care clinician 3 times with the same symptoms or worsening symptoms and a clear diagnosis hasn't been made, then it is time to pause and reflect, review and rethink. When you reflect, have a look through the notes. Are there any emerging patterns? Has the patient been seen, examined, seen face to face and examined? Have all red flags been considered? Has there been any continuity in the care of the patient? The benefits are serious diagnoses aren't missed, diagnoses are made earlier, patients are referred appropriately if they need to be seen in secondary care, and it also strengthens the trust patients have in their clinicians when they feel they're taken seriously, and patient outcomes do improve when patients feel that they are listened to. It challenges clinicians to avoid age stereotypes, to think outside the box, because sometimes you do see cancer in young patients and younger patients, and if we don't think about it, we may miss the diagnosis. So Jess's Rule encourages us to not to get too hooked onto someone's age when we're considering possible diagnosis. Finally, this isn't just for clinicians. If you're a patient and your symptoms are ongoing, worsening, or simply don't feel right, speak up. It is your right to speak up and ask for a review. Share your concerns with your clinician. If you don't have a clear diagnosis after you've been to your clinician 3 times and no clear diagnosis, you can mention Jess's Rule. Jess's legacy reminds us that sometimes the most powerful intervention is simply to pause and rethink.